Hello, all. Glad to have you virtually here with us today to discuss Healthy Housing Advocacy 101. My name is Darcy Scott. I'm the Senior Policy Advisor for the National Center for Healthy Housing. I have been working in government affairs in a variety of issue areas for over 25 years now, living on Capitol Hill that entire time. I'm thrilled to have a chance to talk to all of you all about what you might be able to be engaged in to raise your level of advocacy at home and in DC. So during this webinar, we're going to have a variety of conversations. First, we're going to talk a little bit about federal healthy housing policy, how it gets made, how it affects us. Then we'll talk a little bit about how the appropriations process works, the money that gets spent that keeps these programs working for you. And then we'll talk finally about why advocacy does matter and what steps you need to take action. Now we're going to hear from my colleague there.
So I'm Sarah Goodwin. I'm a policy analyst at the National Center for Healthy Housing, and I both coordinate the National Safe and Healthy Housing Coalition and manage our tracking of various appropriations for federal programs. So I'm going to cover what we mean when we talk about healthy housing programs at the federal level, what that includes, and some of the funding that goes into that. So when we say healthy housing programs, we're typically talking about work at these three main agencies of the Department of Housing and Urban Development, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. But there are relevant programs throughout the federal government at various other agencies. And one of the things that we emphasize is how healthy housing connects with many other issue areas and topics that people advocate for, and how we can both advocate for our specific healthy housing programs while also be connected to a larger coalition of efforts on things like affordable housing and environmental health. So I'm going to go through the key programs we advocate for and keep an eye on in each of these three key agencies. On all of these pages, the boxes here that are outlined in green are ones where the National Safe and Healthy Housing Coalition publishes an annual funding request. And then the others are just others that even if we don't publish annual funding requests for, we keep an eye on and connect with partners on ways to advocate. Also, at the bottom of each of these slides is a link to the National Center for Healthy Housing's agency fact sheets, which is where these graphics are from and can tell you a lot more about all of the work that these programs do. So at HUD, we have the Office of Lead Hazard Control and Healthy Homes, where the main focus often is on the grant program that this office funds that gives money directly to states and localities to address lead hazards. There is also funding available for other healthy housing hazards, and this office has some duties involving managing and enforcing regulations, including the Lead Safe Housing Rule. The Community Development Block Grant Program, or CDBG, is a large source of funding for lots of programs at the state and local level, but particularly relevant to healthy housing is that a lot of states and localities use these funds to provide match funding for the lead and healthy homes grants, which is a requirement of those grants, or to supplement other efforts to make affordable housings lead safe when they're rehabilitating them. So while it's a much larger program, it has relevance for healthy housing in that sense. The Home Investment Partnerships Program, like CDBG, is a really large source of funding for lots of housing programs at the state and local level, and that includes rehabilitation of affordable housing. So these are the current funding amounts for these three programs in the most recent appropriations bill. The Office of Lead Hazard Control and Healthy Homes is at $360 million. As we'll see later, this represents a pretty significant increase over the last several years for this program. CDBG is at just under $3.5 billion, and HOME is at $1.35 billion. So as I said, CDBG and HOME are very large programs that cover a lot more than healthy housing, but that are important for us to keep an eye on and be aware of, even if they're not our main focus. At CDC, we track 4 programs within the National Center for Environmental Health, as well as being aware of other CDC efforts. The 3 programs that are outlined in green here are grant programs to states and sometimes localities, but primarily states, which usually have a focus on surveillance and data collection and helping states keep track of data that they might not otherwise be able to track and collect. There's programs that cover lead, the Childhood Lead Poisoning Prevention Program, asthma through the National Asthma Control Program, and then the Environmental Public Health Tracking Network, which covers a variety of healthy homes and environmental health topics and enabling data collection on a lot of different issues. The Environmental Health Laboratory, which we also keep track of, helps states measure and track exposure to harmful chemicals. These are the current funding numbers for these programs. They're smaller than the programs we just talked about at HUD, with the lead program being at $39 million, asthma at $30 million, tracking at 34, and then the Environmental Health Laboratory at just under $68 million. Programs at EPA cover a variety of healthy homes topics, and some of these boxes are combining a couple of different programs and efforts in that agency. Topics covered here include lead, radon, indoor air quality, and then specifically protecting children's health and other sensitive populations. Activities of these programs include grant funding to states, managing and enforcing regulations, coordinating programs across the agency, providing training and resources on these topics, providing workforce support, helping manage and consult across government priorities for these programs, like the National Radon Action Plan, for example. So there's a broad variety of activities that are covered within EPA's programs, and these programs are funded at some smaller levels than what the programs we just covered. And some of these numbers here are combining a couple of different line items within the budget. Lead is at about $27.5 million, radon at about $11 million, the focus on children and other sensitive populations at $6.2 million, and then other indoor air is at about $13.7 million currently. So as I said at the beginning, these are just some core programs on healthy housing that we focus on, but there are a lot of other programs at many other federal agencies that fund services that support healthy housing or other social determinants of health, and that are important to be aware of and partner with other groups on advocating for. These programs that we keep an eye on and track include programs at HHS, USDA, DOE, and other agencies, and they cover activities like health and nutrition and development for young children, pre- and postnatal care and home visiting services, affordable rural housing, veterans housing, weatherization and energy assistance for low-income homes, and development of energy efficiency solutions. And there are probably more things that you might be able to think of that have an impact on healthy housing, or where healthy housing can have an impact on these efforts. So with all that said, why do we advocate for these specific programs? The tactic that we've taken is that addressing healthy housing issues is work that has implications for programs across the federal government. And we focus on these programs that specifically address healthy housing, as our role as healthy housing advocates and experts is to prioritize our resources on the programs that are most specifically about healthy housing issues, while it being really important to listen to partners for guidance on programs that address children's health more broadly, or affordable housing more broadly, or energy efficiency more broadly. So it's both our role to be critical experts and leading voices on specific healthy housing topics and programs, but also our role to be part of these larger coalitions on housing and health to listen to partners on those other programs that we want to support. So I wanted to also highlight a couple of recent funding victories where increases owe a lot of support, a lot to the combined efforts of many healthy housing advocates and groups. And that really demonstrate that advocacy is important and that calling for increased funding numbers can get results. So at HUD, this is the Office of Lead Hazard Control at Healthy Homes. And you can see that after having been kind of pretty flat funded at a little over $100 million starting in 2017 and then continuing through the following years, we started to see a lot of increases to this program, with the current funding number of $360 million representing a really significant increase over where this program had been for a while. So this has been so exciting to see this representing all these resources that can go out to states and localities and enable a lot more places to be able to do this kind of lead hazard control work. At CDC, the lead poisoning prevention program had been nearly eliminated in 2012 and 2013. Previously, the high watermark for that program had been at about $35 million. And so over the following years after 2013, the funding started to creep up again, with 2018 finally reaching where it had been before, kind of fully restoring funding to that program. And then in subsequent years, setting a new higher watermark, we're seeing more funding for this program than had ever been specifically allocated before. So that's been really exciting as well to see, enabling new states to get this funding and new things for this program to do, and hope to continue seeing this program grow and put more money back into the communities. So I'm going to talk a little bit about how the funding process sort of works. So important subcommittees that we focus on, these are subcommittees of the larger appropriation committees in both the House and the Senate, are the Transportation, Housing, and Urban Development Subcommittee, which obviously includes HUD. Labor, Health and Human Services, and Education includes CDC's funding, that's where that lives. And then Interior and Environment includes EPA's funding. So those are the three subcommittees where it's important to connect with those members and provide our funding requests to those subcommittees. The typical timeline that we've seen over the past several years has been subcommittees taking requests in March or April, and then subcommittees and then subsequently the full committee marking their bills and releasing their bills in June or July-ish. And then the federal fiscal year ends at the end of September. So if there hasn't been agreement on the new funding by the end of September, they will issue a continuing resolution in the fall. And the past several years, that has always happened. There's often been a continuing resolution through, going into the fall and the start of the winter. And then what we've seen in the past several years is an omnibus bill package combining a lot of different agencies, or sometimes all of them, into one big package in late fall and winter. So that's been the typical process. The big caveat here is that this year is different because of both a focus on COVID-19 relief legislation and the change in administrations. The timeline may be delayed or different or have lots of different considerations this year. So again, this has been the typical sort of process, but we're expecting to see some changes in how we specifically talk to offices this year. Darcy, is there anything you'd like to add about this year and what makes it different?
Yes, so typically when we have a new administration, as we have this year, there is a bit of a delay in when the budget that the president would like to present to Congress comes out, because there has been a gap in the workflow. And this year is an even more unusual year. The Office of Management and Budget, which is the office that writes the budget for the president, did not have a very smooth transition from the last administration to the new administration. Therefore, there has been even less work done on the president's budget, and therefore it should potentially come out later than it usually does. April we'll be lucky if we see it by April. It is also the case that when we have an election, many of the offices are changing, and when we get new members of Congress, that means the committees have to resort themselves as well. So there are new committee members, there are new subcommittee members, there are a lot of offices kind of learning how the process works. So that does put a delay in things, but the Congress has managed to find a way to get their money organized every year, and they will again this year. So let's talk a little bit more about how we can influence federal policy. There are a variety of levers that you, as folks who are constituents and folks who have extra working knowledge about these areas, that can engage with the folks in DC to make sure that you improve the outcomes that you want to have back home. So in terms of administrative action, that is the folks who work in the White House who might cover this issue area, and it's also the folks who work in the agencies. Some of those folks are appointees by an administration. Quite a few of them are career government workers who have been in those agencies, whichever administration came and went. So not only do you want to be in the position of commenting when agencies or the White House ask for comments, you as subject experts are obviously always encouraged to do such, but it also would behoove you to build relationships with folks within the agencies who might be part of the people who are going to create a policy that can have effect with you back home. So as much as people think of laws getting made by Congress, the reality is much of that information that gets turned into a law comes from the agencies themselves and the issue experts like you all. So then there is also congressional action. You do want to have an engaging relationship with your members of Congress, the ones that are representing the areas where you're doing your work. They have staff that work for them, and we'll talk a little bit more about that further along in this presentation. But building a relationship with those staff so that they know that you are an issue expert and that you know what's happening on the ground back home where you are while they're in Washington is a vitally important role that you can play. We obviously here in DC help you by tracking things that are happening day to day in DC. And so we go out to you and say, We know an important ruling is going to be made. There's a piece of legislation that's out. It's time to have an appropriations request, and we go to you and say, would you please sign on to this letter? The reason that sign-on letters are so important is because when we go to an office and say, here are all the folks around the country who care about this issue and would like you to have a position, that office is immediately going to look down that list to see if there's anybody who is representing their local district. And so the more of you that we have in places where there are members who care about this issue, the stronger we are able to work as a coalition. We obviously work on and talk to you about endorsing legislation. There are pieces that get written that can do us great harm. There are pieces that get written that can do us great help. And so we try to track that and keep you all as engaged as possible in knowing about what's going on. Obviously, there are opportunities to testify locally where you all are. And I know that when you have members who are back home, they do town halls and have events where you are able to testify. But we also have folks who come to DC to do that as well. Obviously, we're living in a weird COVID time right now, but hearings will happen again. Right now, they're happening on the Zoom or the team, but they will happen again. And then finally, when you do come to DC, getting to actually meet with your member of Congress. But once again, that can happen back in the district. And for the virtual Hill Day that we're having this year, which I hope all of you will want to participate in, we will be having calls and video conference conversations with staff and members of Congress. And the exciting thing about that, although it's different than actually coming to DC, is it gives such a wider variety of people an opportunity to participate. We have so much more ability to bring local stories and local constituents and a wide variety of folks to a meeting than we would if we were just seeing who could come to Washington, DC. So although it is different than it was when people came to the Capitol, it is also, I think, a new opportunity to engage even more participants and bring even more stories about the issue to town. So these conversations that we're having now, the artwork that goes with it was all back in the time when people actually came to town. But many of the things about those meetings will be very much the same as they were when people came to town. There is an opportunity to meet with members and with staff, and I always want to remind people, meeting with a staff person is no less important than meeting with the member. The staff person, although oftentimes feels like it could be your child or your grandchild, is the person who is the main advisor to the member of Congress on that particular issue area. And so the relationship you build with the staff person is just as important, nay, probably more important than having the member of Congress recognize you when you walk into the office. So when you're meeting with members of Congress, as I mentioned before, there's an opportunity to go and meet them in the district. And I know that we've had a number of groups who within the coalition who have organized and gone to in-district meetings. And then there's the opportunity to talk to the folks who work in DC. Oftentimes, the folks who are in the district office work much more on actually providing services like help with Social Security checks, help with Veterans Affairs issues. And it's the folks in DC who are the more oriented towards legislation and issue areas. So we typically want to make sure that we know both offices if possible, but making sure that you have a connection with the DC office is very important. And so the meetings that we're planning to have, which are virtual, will still follow the same format as a meeting that would happen in person. They'll go probably 15 to 20 minutes. There should be in a group that is going to have the call some assigned roles so that one person can introduce folks, one person can take notes, and you can have some folks who tell stories. The staff are typically, as I mentioned before, young, sharp. They're going to take a lot of notes. I think one of the things that people are concerned about is that they think that somehow that staff person is going to grill them or ask some kind of a gotcha question, but that's not exactly what the staff is interested in. The staff need to know that there's an issue expert back home in their area who can tell them quite quickly and quite thoughtfully about what's going on when the member needs to know that information. And so that is the relationship you're building. So what you want to make sure that they know is that you have the details about what's happening at home. When we get to the end of the presentation, Sarah will talk a little bit about materials that are available, and we do fact sheets for every state, and you are able to have a nice detailed piece of information that is across all 50 states, giving you information about the agencies and how they have impact in your state. But we also know that you have even more local information. You have more detailed information about what is happening in your district, and that is what the office would like to get from you. Now, the whole conversation about lobbying. So lobbying means you're asking for a specific bill to pass, or you want a vote to happen in a specific way. 99% of what happens in meetings is education. Education is not lobbying. You are there to tell them what you know about what's happening at home, in your district, in your state, with their constituents, and that has nothing to do with lobbying. That is education. So do not feel like there is some aspect of having meetings with staff that would be a conflict with your job. You are giving information to someone who needs to know more about what you know. So in the meeting, and once again, a Zoom meeting should be pretty much like a meeting was in person. Everyone will introduce themselves, and typically we try to start the meeting on a positive note. If there is something that this member of Congress's office has done that you know is beneficial in the district, it's always good to be able to start out with a thank you of some kind. You also are there to actually talk about specific issues. So up front, you want to make sure that you say, we are here to talk about water quality in our district back home. We are here to talk about lead service lines. Whatever the specific issue is that you're there to educate on, you want to get that out up front. Then you want to go ahead and tell the story of why that issue is important in the district. It's very easy to have a lot of statistics and a lot of details, and those are important. You definitely want to have those things. But the reality is you need to be giving a empathetic story about what this issue does to impact the community so that you can get made clear to the staff person, this is why the member should care about this. So after the story, then you want to go ahead and reinforce what you had talked about, go back to those details, go back to that important data point, but it's important that you got the story in to make it clear why that data matters. And then at the end, say, once again, thank you. We'd like to make sure that, lead service lines are a priority for you too, and make sure that you repeat that ask. So here's some examples of how to talk about the issue. So you want to say there's details in there, there's statistics, but it's also a story about what's happened to children. So it's important that you make sure that you connect the data to something that everybody in the room is going to care about. This is back home, these are children, this is something bad that's happening, and here's this specific data point. And then you want to connect it to why the program that they are in charge of, that they are funding, or the legislation that they are looking into can do something positive for their constituents back home. And then you want to make sure that you're connecting what the agency can do and what the outcomes will be to make sure that they understand the full impact of that program. So Sarah's going to talk a little bit about further resources. We hope as many of you can join us as possible for Hill Day, and we will give more information about that at the end. Sarah?
Yeah, so we didn't go into as much of the detail on what federal policy might include. So I wanted to provide some additional resources for further reading if you want to get more into specific policy recommendations. So I'm just going to move through these. One resource that's available for the federal, state, and local level was this report on 10 policies to prevent and respond to childhood lead exposure from the Health Impact Project in 2017. So that's a good resource for specific policy recommendations for all three levels of government. Another great resource is the National League of Cities publication on city-level models to advance healthy housing. And then NCHH also has lots of resources available on local housing codes. So we focused on federal healthy housing advocacy in this presentation, but if you'd like to learn more or start thinking about influencing policy at your state or local level, there are some resources available. These are specifically on local housing codes, but again, as I said, the previous resources also provide information on advocacy and policy recommendations at those other levels of government. And then I also wanted to talk a bit about the National Safe and Healthy Housing Coalition. So as I said at the beginning, one of my roles is to manage this coalition. And if you want to stay updated on funding and opportunities to engage, as we've talked about in this presentation, one great way to do that is through joining the National Safe and Healthy Housing Coalition, which includes publishing annual funding asks, sharing sign-on letters, and doing a Hill Day. So our Hill Day for this year is the first week of March 3 and 4. So that'll be I guess, next week by the time you hear this presentation. And I know that many of you are already signed up for it, and we're looking forward to those meetings. And again, if this is something you'd like to do in the future, but you haven't been engaged in, you can join the coalition or reach out to me, and we'll get you connected to the other groups that are working on this advocacy and how you can be involved. We've talked about Hill Day because it's our kind of big, regular event to contact members of Congress. But as Darcy was talking about, there's lots of opportunities to connect with members of Congress throughout the year, whether that's the staff in DC or the staff in your home districts. So even if it's not during Hill Day, but you'd like to talk to us or talk to other coalition members about how to do this kinds of advocacy, that's something you can do year round, and something that there are lots of organizations that can partner with you and put together a small group to go meet with your member of Congress or work together on what your asks are or how to represent what's happening in your state. So that's the end of our presentation, but thank you so much for listening at this virtual conference. And if you have questions or want to be engaged in this kind of advocacy, you can reach out to me or Darcy or visit the information on the slide here, and we'll be happy to connect with you.
Thanks, everybody.